EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. Every week I come here with a different guest and lots of news to share. And this week is not going to be any different, except that I brought one of my best staff members here. No offense, everybody else, but Dr. Heather Miranda is really a powerhouse in that she's a type AAA. And so we appreciate all that she does to keep our operations going. And we're going to talk about a new site of operations today.
Yes, we are opening our West Community Health Center. Treasure Coast is opening it on September 2nd. And we're super excited. It's at 8505 20th Street, where the old Clifton Furniture Building was.
Out by the expressway.
By the expressway. And we are going to have a full complement of services. And so we look forward to folks coming out and seeing what all we have to offer. But it's been a long process for us.
It has been. And in fact, we had planned for a big open house and ribbon cutting. But anybody who's done any construction projects know that the one thing you can count on is delays. And so not to be disappointed, we are still hoping, finger crossed, that everything will come together off the checklist and we'll get our business occupancy license from the county and open up maybe even a day or two before. But we really believe in prepping to make sure that our staff are comfortable, that they know where everything's at, that if there was an emergency, they'd know how to react. So September 2nd seems to be the date.
It's the date right now, and we anticipate we'll have dental, we'll have family practice services, we'll have pediatrics, and behavioral health. We also have a really nice pharmacy that's coming in, but that's going to be a little bit delayed, but we're super excited about that, and that'll be coming in probably at the beginning of the year.
So for folks that don't know about our pharmacy services or dental, I think most everybody in town knows that we have absolutely the best dental prices in town, and with a very, very proficient staff in terms of being able to deal with a variety of situations. But for pharmacy, most physicians don't have a pharmacy in their own building. So tell us a little bit about that and the 340B federal legislation that allows us to do that.
Yeah, absolutely. So we as a community health center are very fortunate. We have 340B pharmacy, which I can explain a little more about. But you're right. Most doctor's offices you walk into, there's no pharmacy there. And so we have that as an added benefit to our patients, but we also offer the lowest prices in town. And the reason we do that is because we have 340B, which it's a government program, and we're able to use those resources to put back into the organization and give people the low prices and give more services. And so on a daily basis, we are encouraging our patients to use our pharmacy services. You do have to be a patient of Treasure Coast to use the pharmacy. But we are the best game in town with pharmacy and highly encourage it. And what I will say is when you go to an outside pharmacy, you don't get the level of customer service and care that you get from our folks. Our pharmacists are dedicated, they're extremely kind, and they will make sure that folks leave with their prescriptions. We want to make sure you get the services, the medications that you need. And I think that's very different than what you might find in an outside pharmacy.
I will never forget standing beside a pharmacist who was dealing with someone who was from another country, and so their English skills were not to the point where the pharmacist felt that instructing them in English was going to be sufficient. So the medication needed to be taken in the morning and the night. And so to eliminate any confusion, she drew a picture of a moon for the night, star for the day, and a slice of pizza for lunchtime, just to make sure that they understood. And so you're right. Our folks are dedicated to meeting people with the situation that they uniquely have and helping them through that moment. And it doesn't sound like much, but when was the last time that anybody in a commercial pharmacy really took that time to understand and find a solution similar to that. It will always stick in my mind.
Well, another great benefit is that your provider has a relationship with the pharmacy as well. And so there's a lot of partnership that happens between our providers and our pharmacy, and we're able to make changes quickly for you. Whereas if you are working with another outside commercial pharmacy, there's a delay. We also have a quicker ability to get prior authorizations for people's insurance companies. So we have a really strong team.
And they use a lot of pharmacy benefits that come from the manufacturer themselves.
Correct.
And so, again, that is something that if you are very competent and comfortable on the internet, you could probably find those coupons or those prescription assistance plans. But we not only know about them, but again, our pharmacy techs will sit with someone and help them fill out that pharmacy assistance program.
Yes.
So that not just once, but over the course of 6 months or a year or more, they can get those medications at a price they can afford.
Absolutely. And another great benefit is our mail order and our delivery.
Good point.
And a lot of outside pharmacies are offering this now. And we offer it at no cost. We want our patients to have their medications. And so for some folks, traveling or transportation is a challenge. And so we have that as a no-cost service for our patients.
And the bottom line is it helps our bottom line a little bit in that it does, some of that discounting is pushed back to us so that we can have PhD pharmacists. They have special certifications. They can give immunizations. They can really be that side branch to our physicians with the medications.
Absolutely. And we actually do have the vaccination piece, and we are looking at different services that can be offered through the pharmacy so that a patient may not have to see their provider. They can just see their pharmacist, which is amazing.
It is amazing to me. And the thing that I always get questioned about when I'm out in town is, well, but I have a physician. I don't want to change my medical, but I might be getting some counseling, or my child might be getting some counseling. Well, those medications, good or bad, can be expensive. And so, again, it doesn't matter what service line you use. If you're a patient, you qualify for the pharmacy.
Correct. And that's a huge benefit. Encourage, if you have questions, please reach out to us. We would love to give you more information about it. And we are excited to open the new one in West, but it'll be a little bit delayed, but worth the wait.
Federal bureaucracy at its finest.
Yeah, exactly.
Yeah.
But we do have a lot that's going to be happening at West. We, obviously we'll have laboratory services. We'll also have x-ray services. So it's a full complement of everything.
And no facility fees.
And no facility fees.
Did I say that out loud?
Yeah. No, sorry. and in the reality, we are right off the expressway. We do know there's a lot of construction that's happening up there. And we also know that there's not a lot of healthcare options up there for folks. We've got a lot of inquiries. People are waiting. They're waiting for us to open. So we're excited. It's going to be happening soon.
Yes, it is. So we've got dental services, and those are at Fellsmere and Oslo and in town across from St. Helens. So we've got 3 now. But this service will also have dental services, including for children. And we went by there a couple of days ago, and I was really excited to see that they've got 2 areas just for kids right next to the pediatric center. So in fact, the pediatricians and parents can come and see that you can peek in through some sliding barn doors,
yes.
Which is really cool. And of course, we'll have all the temptations for kids to watch videos instead of saying, "Why is that?"
And we're really excited about that connection, being so close to the pediatric department, because the mouth is an important part of our health, and we know that when kids get care early, that carries through the lifetime.
Sure does.
And because a lot of parents are unsure when they're supposed to start taking the kids in, and so this is an opportunity for collaboration between the two areas. And you're right, the barn doors are open and folks can communicate back and forth. And also, it makes it, I think, a little bit less scary. It's an open environment. And to your point, we're going to have videos and those types of things to make kids feel more comfortable.
Absolutely. We do take Medicaid, by the way. A lot of folks have asked me about that too. If I only have Medicaid, I don't have regular insurance, will my children be covered? And the answer is
yes.
Absolutely yes. And this is a point too that we've always had a lot of people struggling to get on the schedule. We are going to a call center so that will be relieved by professionals, and our staff can really focus on what they do the best. So that'll be coming at the same time. And we really, really would like to get our teens, our young preteens even, back in because there's a heavy emphasis when the children are little, whether it's for medical and immunizations or dental services. But about the time that they hit 9, 10, the interest in going to a health center is not as high. Yeah. Nobody's mandating that you prove A, B, or C. And yet the children are growing, their needs are still there, they're developing new habits, as it were. And so explaining to them with pictures of how much sugar is in the various drinks that they like and showing it to them really can be an eye-opener. So it's no longer mom and dad say, soda's bad for you. They can see and have the opportunity to make those decisions themselves. I'd rather have water. I'm not going to have milk right before I go to bed unless I brush my teeth again, those types of things.
Well, and I do think it is really the whole patient-centered approach and bringing the kids when they get to that age in, because you're right, it does kind of fall off because, if they're not in sports, there might not be a reason, but always a good idea to come in and make sure that your child's getting their physical. And, there's a lot that happens in school. A lot of times the kids get a little older and they're not sharing with you.
Oh, so, definitely.
So it is good. And we will have a full-time pediatrician at the West location. We expect to add more. And we hope folks are going to be excited to come in and bring their kids in. But yeah, teens are definitely a challenge sometimes. And I know even for my own, it does slow down, but
we've got young staff, we've got experienced staff, we've got a nice mix of people that you can choose from and then stick with that. Or if it's not a good match, try someone else, but it's the patient's choice, including the children. So we're going to take a short break for a word from our sponsors, and then we'll be right back.
All right.
Stay with us. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock tariff-free coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in the latest styles and colors from Tommy Bahama, Lexington, Hooker, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of American-made Telescope, Berlin Gardens, and Pollywood, all with no tariff ever. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a summer sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Come in now for our summer sale and visit our website at sunshinefurniturecasual.com.
Welcome back to Community Conversations. If you're just joining, I'm speaking today with Dr. Heather Miranda, who is our EVP of Operations. That basically means she runs around with her hair on fire most of the time because we already have 8 locations throughout Indian River County, and we'll be adding a 9th in just about a month.
Yeah.
And so we believe in consistency and high service. So with this opening, we'll be doing some things a little bit differently. I mentioned earlier we have a call center that we're bringing on board as well, because we have tried to answer phones timely and correctly and with a smile on our face. But we've honestly, no matter what we seem to do, our staff have, despite their hard work, just been overwhelmed by the volume. I think you mentioned yesterday at closing time there were still 70 people in the queue for the phones to be answered to them. Terrible customer service on our part, but again, we found a different solution, and it's been used elsewhere at other community health centers with high marks. So we're going to try this, and
we're excited about it.
Yeah,
yes.
we are excited about it. It would just happen, but I'm kind of the Nike girl. Let's just do it, and everybody goes, you don't understand. There's regulations. There's this. There's that. So most of the time, my hair's on fire, but it's not about my activity level. It's the lack of activity. But anyways, when we went by the other day at 85th and 60, it was really cool to see the outside now has what appear to be like little umbrellas over the doorways, and they are being marked as pharmacy and pediatrics and dental, which would lead one to believe that family practice is not going to be there.
Correct. And that is not correct. We have designed the location differently than some of our others. And so when you pull in the very front, you're going to see pharmacy, pediatrics, and dental. And when you come around to the left-hand side of the building, there's another entrance for behavioral health and family practice. We've known for a long time that having one big waiting room can be really, really noisy.
And overwhelming.
And so the way this is set up is dental has their own waiting room, pediatrics has their own, pharmacy has their own space, and then the behavioral health and family practice has their space to help kind of with noise and, just so many people. Some examples of people come in for dental and maybe they would walk in and there was someone sick. We want to make sure we keep everybody healthy.
Mm-hmm.
So we're excited about that. But yes, it is a little different, but there is a good entry point on the side for family practice. And the building is gorgeous. It's beautiful inside.
And it's huge. It's 17,000 square feet. So
yes.
We knew that we needed to divide it up a little bit. We've got 3 very long hallways, but we've divided those up as well by doorways and the way space is laid out. So again, just being conscious of the fact that many of our family practice individuals, adults, we slow down a bit. We don't like to walk as far, or maybe we're not able to walk as far. So we've tried to set it up, I don't want to say as a pod, but certainly with those things in mind.
Yeah, and also, as we said, with the noise, and not that everyone doesn't love kids, but sometimes it's nice to go in and that there's not children all over. And on the other side of it, on the pediatric side, we are setting it up so it's fun for the kids. Mm-hmm. And there's area where the teens can be, and then there's an area for the little ones with some tables and books and things like that, so kids can have a good time.
Yeah. So I really like that. In theory, let's see how it works out, because again, it's not the way most of our centers have been set up. But I do believe that having an X-ray unit and a lab there in the family practice area will make much more sense than anything else that we've done so far. So
yeah, it's exciting. I mean, it is definitely new territory. So
behavioral health, tell us a little bit about that service. I know that has evolved over the years. Initially, we had Dr. Borromeo, and she would see our children. And then the demand started to increase, and so we started to hire more individuals, including nurse practitioners who have prescribing information at their fingertips, as well as experience, every single one of them, in some mental health environment themselves. So who will be placed there?
So at the West location, we have 5 behavioral health offices in there. Our director of behavioral health will spend some of his time there. He sees patients. He's a psychiatrist, Dr. Gadd. And then we will also have 2 to 3 therapists, as well as another prescribing nurse practitioner. And we're really excited about that. We also do have our substance use disorder manager, Audrey Lancaster, will be there as well, providing services. She does injections for folks that are receiving treatment. So we'll have a full complement of staff. We're really excited about that. We do know that right now that we do have a bit of a backup. We're bringing on some new, very highly qualified LCSWs on staff to meet the need. And so we're really excited.
That's great.
It's a very nice area. And it is, like you said, it's a little sectioned off so that every area has a little bit of privacy. And BH is an important area for that because there's a quietness and all and privacy that needs to be in that area.
So will the behavioral health specialist be able to see children, or is it just adults?
No, children and adults. Yeah, we have a mix of staff in there and they can see both. And so that's really exciting for us. Sometimes it's hard when we recruit staff because some folks are not wanting to see kids or the opposite, but we'll have a full complement and people can come in from 3 to 4. We actually have some folks that are doing therapy as young as that, all the way up to
103.
103, yeah. So yeah, it's we're really excited. The team is super excited about it. And we do have a lot of staff excited to work at that location. We do have a lot of staff that are not located in Indian River County, and so it's exciting to have that location.
They can jump on the expressway right there and go north or south.
Exactly,
Yeah,
exactly.
That's a huge help.
So yeah.
So will the behavioral health people be able to do telehealth as well, or will everybody try to cram into those 5 rooms?
So that's a great question. So we currently offer telehealth services. Almost all of our providers are hybrid, so they do some telehealth and some in person. Okay. We do get a lot of requests for in-person services, but we do recognize that some of our patients have transportation issues, or they may like or prefer telehealth. So we do offer both options, and the providers that will be there will offer those options.
It sort of sounds like the feedback that I've gotten from our providers, in that for some, it's a little awkward. Because they're used to a face-to-face exchange. But for others, they tote the benefits of, I see the child or I see this teenager in their own environment, and it helps me understand their activity levels. Yes, I don't always get to see everything, whereas in the office, I might see them, tapping their feet, right. And I can't see that on this, but I get other cues and other clues about their behaviors, not invasive into the family or the home, but just a different environment gives you different clues in terms of what they like, what their behaviors are motivated by, and those types of things.
Well, and also too, if you think
no
about
perfect solution, I guess.
No, there's not. I mean, you think about what's also comfortable for the patient, and for some patients, being in their home is comfortable and they would rather do that versus the white coat syndrome when you walk into a doctor's office and you feel kind of stressed about being in that space. And so, yeah, we absolutely have that flexibility, and our providers are very flexible with it. And so we're excited to be moving forward with having the new folks there for BH because, as I said, we've been getting pretty busy.
Yes,
I think everybody knows behavioral health services can be difficult to find.
Well, and a lot depends on your insurance or lack thereof. And so I just want to give a plug out for, again, it doesn't matter whether you have insurance, whether you have a high copay. We're going to help you with that because we have health navigators that will ask you to bring in the pertinent information, and then that will again, ease that issue of concern.
Yeah, we definitely want to make sure folks know about the health navigation. And so we, as Treasure Coast Community Health, as all health centers, we offer sliding fee discount. And we want people to apply for that to receive the discount so they can get the health care at a lower cost that's more affordable to them. So we will have a health navigator on site at that location.
Awesome. So we're going to wrap up here because we've used our 24 minutes and then some. So I want to thank you for listening to the very end. We will be back next week with a different guest, and I'm very, very hopeful that we'll be seeing us, if nothing else, but for our open house, which we will still be having, but probably not set the date until early October. So we're really sure that everything is just the way we want to proudly show it off. So take care, and we'll see you next week.